It's estimated that more than 2/3 of jail detainees have a substance abuse disorder, and almost 1 out of every 5 has a serious mental illness. The Granville-Vance Department of Public Health is leading a 5-county initiative to respond to these numbers. It's the only multi-county initiative in our state. Dana, these are difficult issues. Let's talk about how you get started as a community when you're balancing public health and safety against these issues of mental illness. What are your recommendations to communities for first steps?
So I think the first step is always, before implementing any program, is to assess the needs of the community. And when one does that, typically we encourage, in public health, we encourage you to work with your community and with your community partners. And that includes not only understanding those players who have roles of sort of your traditional responsibilities like the criminal justice system and your public health practitioners, but also understanding directly from those who are being serviced by these communities. And so starting out with really understanding what the needs are of the community is a great first step before implementing any program. There's no prepackaged solution to this problem. I think North Carolina is doing some very unique things around understanding the needs, but also making sure that our community is trained once they understand, how to understand those needs. And so
Robin, let me turn to you because communities need resources in order to do this work. You don't understand the needs just because you're talking to people. So what does the state offer communities?
One of the exciting things that we've done as part of our North Carolina Stepping Up initiative is that we have trained this summer a group of facilitators who can do an exercise with a county to bring together elected officials, law enforcement officers, healthcare professionals, the judicial system, hospitals, and bring folks together to a community to kind of understand and map where the strengths and weaknesses are. And it's called sequential intercept mapping. And that's one of the things that we decided that we were going to invest in so that we would have folks in North Carolina who could provide this for free.
And so what do you call to access this resource?
I would say that we call Bob Kurtz at the North Carolina Department of Health and Human Services.
I knew there was a reason you were here, Bob.
Because Bob can help facilitate. He is doing these facilitations and helping get folks to do that.
So Bob, say a little bit more about how the person who needs that resource connects with you and gets it.
Yeah, they can contact me at the state's Division of Mental Health. I can provide my email address, or nc.sim@dhhs.nc.gov is the website or the email address that you could contact me at. But we have, as Robin was saying, more than 20-some facilitators, including university professors from University of North Carolina, Chapel Hill, Duke University, experts in working with people with mental illness and criminal justice involvement all around the state that can look in a very structured way, help counties look in a very structured, methodical way at what their community resources are and what can be done. And the outcome of that is a map of their local system and an agreed upon plan for how that community is going to address these local problems.
So I've heard 3 things so far: the mapping exercise, the getting the right people together at the table, all these constituents or stakeholders, and then the plan. And then what comes next from plan to implementation?
We've seen champions in our county, in Alamance County, who've just come to the forefront. Our sheriff is very involved, our county commissioners, our United Way, and folks are coming together and kind of pooling resources and finding funding just to work on the projects we think is important in our county.
Yeah, that sequential intercept planning process gets those individuals together to jumpstart that Stepping Up initiative so that the outcome is the plan that then there are agreed upon responsibilities for each partner to be able to implement it and then evaluate the progress.
one of the important things I think is that these plans bring together your non-traditional partners in a way where you can identify unique resources to really then come back to serve the community and make a healthier community.